Hi, this is Dr. Srikanth. Now I'll have one more case-based discussion. So going into the case scenario, a 38-year-old male patient having a chief complaint of swollen gums and the bleed when he brushes. The patient is a non-smoker but hypertensive, make a note of this, and is under medication with a particular drug. The drug name is important, from past 5 years. The probing depth ranges from 4 to 8 millimeters and bleeding percentage is 55 with moderate oral hygiene, and radiograph shows a normal alveolar bone. So the key words are the normal alveolar bone, and you can see the pockets are there. So whenever you have a normal bone with a pocket, then that is called a pseudo pocket. Then that is basically gingival enlargement, retrograde. So retrograde way of handling. So it is basically due to gingival enlargement. What happens here? He's using a drug. Okay, basically this drug is a calcium channel blocker. Okay, which will cause gingival hyperplasia. Okay, so clearly you can appreciate on this clinical scenario, and of course radiographical features are completely normal, right? So it is most often associated with the soft tissue changes, not a hard tissue change. Okay, so this can be gingival enlargement and it's basically due to the drug. Okay, so what you have to do, you have to reach the physician and make sure the drug should be changed to a better drug. Drug should not be stopped, drug should be changed. An alternative drug should be should thought of an alternative drug. And what is the mode of treatment for gingival hyperplasia is you can go for gingivectomy, maintain the proper oral hygiene, alteration of drug has to be taken. All these are simple logical explanation. We'll go what are the questions that are given in this case scenario. So question number 1, basing upon the present clinical information, what type of pocket it is? It is gingival pocket. Why not periodontal pocket? Because there is no bone loss. You need a bone loss for a periodontal pocket. So the answer is A. Simple. Go for the second question. Which drug commonly leads to gingival hyperplasia? Yes, calcium channels will do that. Cyclosporin will do that. Anticonvulsant drugs will do that. The answer is D. It's all of the above. The next question. What will be the appropriate surgical treatment done for this case? Okay. So if you see stoppage of drug, no. You have to go for alternative drug if it is really required. The second one is guided tissue regeneration is useful for periodontal pocket. Flap osseous resective surgery is useful for periodontal pocket. So these are related to periodontal pocket, so you can eliminate them. So gingivectomy is related to gingival pocket. The answer is A. So this is how you have to interrelate a case-based approach. Like whenever you see a photograph, of course the Neet always, like if you see your Inbde or you can see your Nbde part 2, basically they are giving this case scenario questions, right? So this is how you have to link the clinical findings that are given to the diagrammatic stuff, or the clinical findings that are given to the investigations in the form of radiographs, and of course you have to correlate all the questions and the questionnaires related to this stuff. Done for now. Signing off, Dr. Srikanth from team MDS CONQUER.